Welcome back to the Elle-Sera podcast. And today I've got Dr. Jordan Faulkner. Again, I'm not going to give any preamble because I believe the guest does a better way of introducing themselves than I do. So Jordan, thanks for being here. And who are you and what do you do?
Perfect. So it's lovely to be here. As you mentioned, my name is Dr. Jordan Faulkner. I keep it super casual though. I just prefer to be Jordan or George, so we'll just keep it at that for the rest of today.
Okay.
I am now a full-time cosmetic doctor and clinical educator in aesthetic medicine. I come from a background NHS work. I worked across surgical specialties, including plastic surgery, craniofacial surgery, and some orthopedic surgery in London, until about 18 months ago when I made a full-time transition to fully commit myself to aesthetic medicine, which was becoming more and more obvious that was my passion. So I decided to give it my all. I'm currently running and injecting in 4 clinics, 3 in London. One is just outside Selfridges on Oxford Street, one is just outside the Shard, one in Hampstead, and then I still do one in Yorkshire roughly once a month, which is where I came from yesterday. Still Geordie from the block.
Yeah.
It's quite nice. I get to come up and just see family and friends and stuff and then do some treatments while I'm up here. So I still keep that one running. So 4 clinics across London and South Yorkshire.
Amazing. Wow. Okay. So my next question is, and I think I know what you're going to say is, so I've had a lot of estheticians on here, cosmetic doctors. How do you stand out in an industry that's so saturated?
Mm-hmm. It is saturated. It's saturated for a number of reasons. I'm going to say something that might be slightly unpopular. I think actually to stand out in this industry is actually quite easy if you really fully give it your all and treat it in the same way that you would treat your training for any other medical specialty. Now, the difference is with aesthetic medicine, cosmetic medicine, whatever you want to call it, there's no set curriculum. There's no training pathway that means that you go and become an SHO and then a registrar and then a consultant. Therefore, you don't have these bottlenecks in training where you have to say, on a portfolio, I have done these audits, these research projects, I've taught these programs, and these are my publications that I've put in print. I've spoken at this conference. There's none of that. There's no need to do that. And there's no set revalidation process for aesthetic medicine that means you have to do those extra clinical bits. Now, I wanted to meet aesthetics with the same energy and passion that I was putting into my surgical career. So in my short 3 years in aesthetics, I've been doing all of those things. I've published 3 articles now in the Aesthetics Journal. I'm teaching every month through Foundation, which is the first day of Botox and fillers. And just for context, when I say Botox is to botulinum toxin what Google is to search engines.
Yeah.
I'll just use the colloquialism for the ease of context, but what I mean is toxins, all the way through to level 7, which is essentially the equivalent of a master's in aesthetic medicine. I'm teaching the course on that as well, which I don't have to. It's all extra. When you do these teaching days, you make nowhere near as much money as you do in a day in injecting, for example. But it's the energy in that I want to deliver to that. And I show all of that on social media to my patients to be like, look, I'm not just in clinic injecting all day, I'm really adding to this industry. So if you meet it with that energy and you don't use aesthetics as a get out of jail free card from the NHS, which a lot of people want to do, actually you will stand out just by doing the things that you're used to doing anyway.
That's really interesting. Yeah. So, and it is good that you've got, sorry about that. It is good that you've got that passion for it and you are doing that extra kind of, you're adding value, not only to the industry, but to other aestheticians and giving them help and experience.
Which is actually easier to do in aesthetics than other areas of medicine because it's much newer.
Yeah.
It's a much younger specialty. So therefore, it's rapidly evolving. So new treatments are coming out year on year, new machines are coming out year on year, and you can really add value to the industry and propelling things forward. But also because it's still such an immature industry, it's still really unregulated. So actually in an industry that's just so unregulated, you can add safety quite easily by doing little things. We're hoping that regulation is going to come in 2026, we're told. Let's see. At the moment.
What will that regulation look like?
So the information that was kind of filtered down so far there's going to be some kind of licensing scheme where there's going to be a license required for the injector, the practitioner, and some kind of license for the premises. Now, at the moment, you don't need to be CQC registered to do cosmetic treatments. CQC registry being like, this is a
Quality care
regulated healthcare institution. You do not need that. Whether this license is going to be at that level of standard, we don't know. Whether this license is going to mean that non-medical people cannot inject anymore, we don't know. We don't know quite the nuances, but something is coming. We don't know what it is. But in that period, for now, we still work in an industry that's completely unregulated. It's the Wild West and the sheriff is out of town. People have told you before on this podcast that, because I've watched it, that John the plumber down the street can buy fillers off eBay and inject it into you. And because they don't have a governing body, like I have to answer to the GMC, a dentist would have to answer to the GDC, for example, nurses, the NMC. There's no governing body for Joe Public.
So like beauticians and hairdressers, etc., who are
they
doing...
don't have to answer to the law.
Yeah.
It's not illegal.
Okay.
As long as there's some kind of consent form that they aren't trained in actually delivering an appropriate consent. They also don't have to answer to someone, a governing body, whereas we all do. So it's actually way harder for us as medical professionals to go into this industry because we've actually got Big Brother watching us.
No, I know. I completely agree that. When I used to be a journalist, again, yeah, we would be regulated. And then, yeah, you've got the Press Complaints Commission. Yeah. You also had to have your NUJ card. You used to have to do all your qualifications. And, all that background. Then I'm like, oh my God, and now anyone with an iPhone thinks they're a journalist and they can put something on Twitter. And I'm like, are you joking? You don't know how to fact check. Mm-hmm. You're like, there's a reason that the guy at the BBC is not putting out that information that you have just put all over everywhere and that's completely misinformed.
That's why there's so much nonsense on social media.
Well, exactly. And probably why there's so much rubbish in aesthetics. One thing that popped up then in my head was there's one clinic in particular that I see all the time. They're doing phenomenally well in terms of social media following and, the nurse's lifestyle. She's not a nurse, sorry, the injector's lifestyle. But, and again, I always wonder, how are you getting away with this? It's ridiculous.
I saw something bonkers recently. And so there's a company called Safety and Beauty and they kind of flagged this. And they don't have any power to stop people doing it. They're not like a regulating body, but they at least highlighted something on social media. And there were non-medics being trained by non-medics in a room to do liposuction.
Wow.
Now, when I'm talking about regulation, I'm talking about Botox and fillers. I'm talking about small needles, low capacity to cause infection. Don't get me wrong, you can cause blood vessels to block. You can even cause blindness with filler. But if you're taking a big instrument like that and ramming it through people's fat tissue, because it's quite brutal.
It's brutal.
It's quite brutal. The capacity to cause damage is very high, and we're talking non-medical people. And
even if you are you are, I don't know, cosmetic doctor, cosmetic surgeon, the risk of it is so high.
Exactly.
I remember a case of a footballer and his wife, and she'd gone to have lipo. This was years ago. It must be 30 years ago, and they perforated all her organs.
But
they ended up dying. Do you know what I mean?
Those anomalies where you've gone to the right person and there's still the risk of something so bad like that happening. These people are wearing little aprons, not even surgical gowns. It's you're asking to give this person sepsis. And when they die, in my opinion, you should go down for manslaughter, if not murder.
Yeah. Is this in the UK?
Yeah.
This is in the UK?
I think it was in Clapham, which is on my doorstep.
Oh my God.
I think someone told me it was in Clapham. I don't know that for sure, but it was certainly in the UK. It blew my head off.
Wow.
Yeah. So these are the things that go on and people really don't realise how dangerous of an industry it is in its current unregulated state.
Yeah, so when you see facialists doing Botox and stuff, they've done maybe a course on it or a 3-day course?
Yeah, see, something that sometimes I feel a little bit of frustration from their point of view, and I think they do have a point of view. I wouldn't just rubbish everything because I sometimes see before and afters from beauticians that have been doing filler and I think, Great work.
Great. Yeah.
Great work, because you've been quite artistic there and you've sculpted the cheeks really nicely, for example. And I'm like, kudos. But what happens if you did block a blood vessel? Because the dissolving solutions of prescription medications, they simply don't have access to it. And you need to be injecting that within 4 hours, because if you don't, then tissues start to die and you end up with long-term deformity or scarring.
Right.
So I don't care
Yeah.
how creative or artistic you are. This is a medical treatment and it should be treated as such. But yeah, I think that you'll probably get some people watching this who are beauticians and they're like, we're as safe as you. I'm just not having it.
No, okay, fair enough. Well, I think that you also stand apart because you've come from a surgical background so tell me about your career doing that, because that was, as you said, cranio and facial.
Craniofacial, yeah, which is, so it's a term, usually you would hear it called maxillofacial, but I worked in Chelsea where the department is dual run by plastics consultants and maxillofacial consultants. So it's called craniofacial as an encompassing thing. Now, I only spent a year there as an SHO level, which is like bottom of the ladder, but I still had quite a lot of exposure to facial tissues, the layers, by literally operating on them and manipulating them, moving the bones back into the right place when people have had accidents, for example, looking at the 3D images on CT scans, MRI scans, looking at those structures, manipulating the tissues, like I've said, but also exposure to Botox and fillers, because we ran hyperhidrosis clinics, which is using Botox in the underarm. There were clinics for lipodystrophy patients, which is a complication related to HIV, where you lose all of your facial fat, therefore fillers are used in that capacity in the NHS. So my anatomical understanding of this part of the body, plus the small amount of exposure I'd had to the products that I used, gave me really quite an easy transition to aesthetic medicine, or at least one that was probably smoother than your average even doctor, dentist or nurse moving into the industry.
I always treat some of these podcasts like a bit like a consultation for myself. So so I've always, and you might have heard this me go on about a podcast before, but no one's like completely symmetrical, are they?
No one.
Okay, and I always think that I've got a jaw, my jaw is longer on one side than the other. That's why I always sit on this side of the podcast, if everybody notices, because this is more like, sculpted than this side, which I think makes me look like 10-ton test if I turn around. Like, what's a jaw surgery look like? Horrendous. So, would that be required, or would you just balance it out with filler?
First things first, my level of surgical knowledge doesn't reach that point.
Right.
So when I'm having conversations like this, I have to be very clear with my patient where my level of competence ends.
Yeah.
And that's the first thing you have to do in order to be a safe clinician, no matter what specialty you're in. So there are obviously things that you can do to try and improve symmetries, but it depends upon which tissues are impacting. So if I assess you and I think that your masseter muscle is more hypertrophic on that side, which is the big one here that is responsible for clenching your jaw, I can feel if one's pushing out more. Then that might be an impact. If it comes down to fat tissue, can I really make it symmetrical with filler? I might be able to get a little bit closer to it. That facelift time.
I think it's fat tissue.
It's probably a surgical thing, right? Because I've had it before where patients have said, right, well, I sleep on this side.
Right.
So therefore, this line is much deeper. Yeah, all right, well, I can revolumize that and I can make that symmetrical. Whereas if the problem is that I've had patients who had a surgery on one side, where it's lifted on one side, well, I can't with filler recreate a surgical lift. So you have to know exactly what you can do, but explain really clearly to your patient what it can't do. And only then have you given your patient the tools to make the best decision for them.
Yeah.
So in that situation, I would be like, look, maybe there's an operation that can be done for this. Now, what's important is for me to have a really good network and referral systems.
Absolutely,
which is something that actually, again, people don't necessarily have when they move into aesthetics in the early stages. I'm very lucky that I work with maxillofacial surgeons. I know plastic surgeons. I've got high-flying dermatologists to refer to. I've got that network of people so that I can confidently say, this is the guy for you.
Yeah, 100%. Yeah, and that is so important because you're not going to get that down the local
100%.
Hairdressers, are you?
100%.
Okay, so I was watching one of your videos on Instagram and you were talking about you probably would not inject somebody if they came in and they said, let's say you've got, let's call her Sally, and she comes in and she's 50 years old and she's lost a lot of volume. Maybe she's a bit droopy, a bit jowly and stuff like that. And I want to come in and have a mil of filler.
Fine.
So
it's probably a waste of time is the honest truth. And I only because it's 1 mil. So I think everyone comes in and Sally is probably rightly cautious because of the conversations we've had so far.
Yeah.
everything that you see in the media causes a stigma around aesthetic medicine. And I spend my life picking it apart. But I totally understand it because I used to work in Newcastle, did my foundation in Newcastle, which you've talked about the big duck lips and things on this podcast before. Endemic there, endemic in Yorkshire, here in Liverpool. These are the places where that's the stuff that ends up in the media. Now, as we know, well done fillers, you can't see them. I've got 2 mils in my cheeks. Now, I hope people watching this aren't looking thinking, yeah, I can see. Whenever I tell people that in clinic, they're like, oh, really?
Yeah.
I'm like, yeah, exactly. It's well done, right?
Did you do it to yourself?
Obviously not. Obviously not. And if I did, I wouldn't be saying no. No, I obviously didn't do that myself. I've got a very good network of high-skilled injectors. But yeah, so those people have got that same angst that they rightly should have. But yeah, like you say, all of the visible filler, so all of the filler that people see is bad filler because well done filler you can't see. So that just obviously creates a negative image around the situation. So everybody who comes in, who's new to the industry, is worried. And I spend my whole life reassuring them that they're sat in front of the right guy and no one walks out of my clinic looking like they've had filler.
Yeah.
That would be the worst thing that I could do for them, right? Now, having said that, my next job is to say to them, but you need loads. Right. Okay. So that's obviously a really difficult conversation for me to manage.
Yeah.
But the reason for it is
they're thinking they're coming in spending 250 quid.
When I say loads,
the bill's like £5,000.
Yeah, so I say loads, that's for dramatic effect. But what I mean is 1 mil is certainly not going to give you the rejuvenated look that you want or the refreshed look that you want, because 1 mil is literally that. It's 1 mil. Like, think about how many mils are in that cup. Now, it's very different. It's a gel. It attracts water. It works in different ways, but a mil is a tiny amount of gel. From 25 years old, the biological aging process begins, and that means that your skull shrinks, you get bone resorption, all of your fat pads in your face, it's not just a layer of fat, they're all like little cushions, individual cushions, and they reasonably predictably shrink through your age. Your skin also gets thinner. So losing all that scaffolding, it starts to go like this, and everyone comes in and moans about, firstly, their tear trough, probably late 20s, then the
like
nasolabial folds, then they talk about the marionette lines, and then it's the jowls, and they're kind of like decades apart, but each of those decades, that's what they moan about. But all of those things, I can't just go in there and just put a mil there because all the volume's lost from here. So you'll end up bottom heavy and looking like, you know, the Grinch characters where they're like Whoville, that you'll end up looking like that. I need to actually think about that aging process step by step and reverse it. So I might need to actually restore your temple. I can tell you exactly how many patients have come in and said,
I need my temple.
I've got hollow temples. None. Obviously none. But that's my job to sit and say, actually, you've lost some volume in your temple. That's why you've got hooded lids, because the support from here is gone. So therefore the gap between your lashes and your brows is gone. And then that's my job. But also your temple's gone, your cheeks flattened, you've lost some volume here in front of your cheek. So there are wrinkles here. Maybe the anterior cheek means that your fat pads are moving down a little bit, your jaw, your chin. You need all of those areas to be in the same decade. Because if I say, right, she's called Sally. Right, Sally. Let's just start with your cheeks. Let's introduce you to dermal fillers. I'll just start with your cheeks and then I'll see you in a year. No good, because everything else has shrunk and lost volume. So if you've got the face of a 55-year-old, but the cheeks of a 25-year-old, the person sat in front of you is going to be like, something's not right here. Because the human brain is immaculate at picking up disproportion or something doesn't match. They can't always say exactly what it is, but something will look weird. So I'm having to then explain to someone, I either need to revolumize your face proportionately or not bother. So you might have to pay me $2,500 to put all of your volume back proportionately to keep you looking natural, or you can give me 500 quid and I'll do a bit in your cheeks and you'll look worse. Doesn't make sense. So it's not a sales pitch, which often you're struggling to get across to your patient, because at the end of the day, they're there and they're going to pay you money and you're going to go to the bank afterwards. It is not a sales pitch. And for me, it's never a sales pitch. I know for a lot of people, and I've worked in clinics where they're run by non-medics, and you're actually battling as the doctor in the clinic with the clinic owner who is a business person, because they're saying, can't you upsell a bit of Profilo or tell them they need a bit of Botox in their chin and then that'll be £50 extra per sale and you'll make X amount of pounds per day? No, get out.
Right.
Obviously, I'm not doing that. I'm
Yeah.
not a salesperson. Can you sell this person a £60 cleanser?
Well, that's the other thing.
No,
okay.
I
So,
can't.
yeah, of course. And I get upsold to every clinic I go into.
So I think one of the reasons that I've succeeded, define success, I'm doing what I think is well after 3 years. Full clinics 5 days a week and growing. It's because my patients, I think, are super confident that I am never going to suggest something to them, either to line my own pocket or that I don't think will actively benefit them. I've even had people come in and I've said that they just want lip filler, which is purely cosmetic, subjective, beauty's in the eye of the beholder.
Yeah.
With the rest of the aging stuff, I can give you my opinion based on my knowledge of the aging process. Lips, quite different conversation, isn't it? Because I'm here to give you a service for what you want. But I've actually had it before. I've been like, your lips are so lovely. Please don't touch them. And it's because it comes from a good place and they've gone, I can't believe you've just said that.
Yeah, exactly. Yeah.
But then that's such a powerful tool for me, because then that allows me to actually make those recommendations without worrying I'm going to give someone a complex they didn't already have, because they know it comes from a real good place.
Yeah.
I'm not a money-orientated injector. Does that make sense?
Yeah, absolutely. Yeah. No, I once did my lips and they're bloody awful. I'd never touch them again.
It's a really difficult area to treat. People undervalue, especially on day one when I'm teaching, because lip filler is probably the most popular or most well-known place that you would put filler, especially in the UK anyway. People think it's probably the easiest, but not necessarily.
No.
It's a very sensate area, lots of nerve endings. So if you've got a tiny lump, you're going to feel it, you're going to chew it, you're going to be
I haven't,
poking
to
it
be
with your
fair,
tongue.
but my God, I just, they never went down. It was 4 weeks. They were still not going down. My boyfriend was just
Too
like,
much then.
what the fuck have you done?
Too much.
Like, he was so upset.
Probably
He was
too much.
So upset. Well, they were Russian lips.
Fine. Can I pick apart why we shouldn't do Russian
Yeah, go
lips?
for it. Absolutely.
So people don't understand how filler works. It's a gel, right? It's not scaffolding. So these Russian lips, it's loads of vertical injections. So generally the people that offer Russian lips, if you look on their Instagram page, it's only lips.
Yeah.
Lips. And they all look like the sweets. You know, remember them, the little chewy lip things. It's a gel, right? So all of those pictures that are taken, they use quite a firm filler, a very robust filler, which allows them to almost mold and evert that lip to show an unnatural amount of the pink part of the lip. So in that short term, when they've taken that picture, that gel's just been injected. So it is almost like struts all the way along, falsely everting it. Under pressure though, a gel's not going to stay in that. It's just going to become a big long sausage. Yeah. So 3 to 6 months down the line, when they're not taking pictures and putting them on their social media because they look awful, because that's just become one big fat sausage of gel that's not just in the pink, it's in the white part of the lip as well, meaning you've got no definition at the border and it turns the lip down. So you actually get less lip and it's all just in here. Horrific. But social media shows you these defined, I was going to say amazing defined, but I meant amazingly defined. So I don't think they look amazing anyway.
No, I think they look absolutely awful. But I remember going for my appointment, I had booked in, I paid this deposit, and even the friend I met for lunch was like, what, are you mental? Why would you even touch your lips? You're like, you've got great lips, like leave them. And honestly.
Not enough people say that though, do they?
No.
But yeah, it's even though it's a very risky treatment, you puncture the lips 1,000,000 times unnecessarily. So you're asking for swelling, you're asking for bruising, you're going vertically towards the artery with the filler, so you're much more likely to block a blood vessel. Even all of that aside, even if you think they look good, it doesn't look good for the duration that filler is in there. So it's essentially just a lie.
Apologies for interrupting this podcast, but I need to ask a favour. If you're enjoying this podcast so far, then please hit that subscribe button right now. I'll be straight up and honest that I want to see this podcast grow and flourish into something that I'm really proud of. And the only way that I can do that is with your help. So if you've ever learned anything useful from these conversations, then please return the favour by liking, rating, subscribing, and maybe even sharing it with your friends. Thanks very much. Let's get back to the episode. Yeah.
It's nonsense.
No, they are nonsense. Awful. I can tell you from first-hand experience.
Yeah.
Absolutely terrible.
Did you have it dissolved?
No, I didn't. It's just like gone. Yeah.
Over how long?
This must have been 3 years ago.
Fine.
Yeah.
There's still some a little bit there.
There probably still is.
Yeah.
And by the way, I must have had like jaw filler maybe 5-6 years ago. Well, no, nearly 6 years ago. And I've still got a P that I play with in traffic.
So filler.
A filler that I play with all day.
Filler lasts years and years. Now, this is something that maybe we should be better at as medical professionals at explaining, because if you're sat here now, or let's say Sally's sat here now and she says, so George, how long is my filler going to last? My answer to that, I don't get into the nitty gritty, and maybe I should, of saying a very small amount of this filler might be present in 10 years. What I actually say is, well, it will vary because I have to use different thicknesses of filler for different areas, because on your jaw, for example, I'm going to inject onto bone, and therefore I want something very thick. Around your mouth, it needs to be mobile to move with the tissue. So I have to use a much thinner filler that will break down much quicker. So for the thin filler, it might be about 12 months. For the very thick filler, 18 or even more. But what I mean by that is the result I give you today will last that long.
Okay.
I don't mean
it's going to be evaporated out.
It's disappeared. No. If you do an MRI scan later down the line,
I was just going to say, Alice Hart-Davis did an MRI scan and she still got like loads of filler. You can see it here. And she's like, God, I had this done years ago.
So the other thing that makes them a little bit misleading is MRI is great technology. It shows that different tissue densities, water densities, that's how it separates different types of tissue. Now, hyaluronic acid, which is what filler is made of, is known for its water holding properties. You hear this quote that it holds up to 1,000 times.
Yeah,
it's not, again, that's not quite right.
What is quite right then?
I don't know the exact answer to that.
But it sounds...
But, well, it's silly, isn't it? Because if it did...
It's 1,000 times its weight in water or something.
So if we're injecting a mil of filler, that would mean that you'd have a litre of fluid around. So obviously that's not quite right. But what it does demonstrate, or what it does communicate, is that hyaluronic acid holds loads of water around it. So when you're seeing that scan, what you're actually seeing is all of the water that's surrounded around that tiny little bit of filler. So they do look quite dramatic, but it is a useful way of showing, actually, look, this is not something that's gone in 12 months. So maybe we do need to be better at explaining that to our patients. Probably the reason that we don't is we don't have an hour podcast to explain it. We've got 15, 20 minutes in clinic before we actually then go on to do the procedure. We don't need to get into that level of nitty gritty because it's not going to be systemically absorbed and cause any kind of harm. It's not going to clinically look like it's there in 10 years. So actually, as far as the patient needs to be aware, that's what you're giving them that rough number for. Okay. That makes sense.
Yeah, absolutely. As a clinician, and a really good one, especially somebody who's really prominent, you've written articles in the journals, etc., you must get upsold lots of different products to have in your clinic.
All the time.
And again, it's about maybe looking at the company, is this any good? Because there's some real rubbish I see out there.
Loads.
Yeah. So give us some of the stuff that you would think, oh, it's absolutely pointless. I'd never go near it.
Yeah. So it's a real skill in itself. You have to be quite cynical because you go to conferences. Now, if you are going to a burns conference, for example, because you're working in plastic surgery, it's not a sponsored event. So you've got consultant burns plastic surgery doctors talking to other consultants, and there's no ulterior motive there. Whereas at these sponsored events, the people that are talking or the people that are on stage are being paid by, be it a filler company or a laser company or whatever it may be. Everyone is being paid by a pharmaceutical company, essentially. So you have to sit there and be thinking, out of what I'm being told here and what's being delivered to me, which of this is useful to my patient and which of this is sales techniques? And it's always a spectrum.
I also think they skew all the studies in the data, like all of them, because obviously they're going to make, this has done this. I can give you two things that I think are absolute crap. Have tried them both, and purely just I know they're crap. First of all, years ago, fat freezing.
Yeah.
Utter rubbish, doesn't work, absolute nonsense. Nobody's going to lose any fat doing this, and you'd actually be better off, I don't know, actually just eating a little bit less.
To show that if you essentially, whether it be fat freezing or fat dissolving, there's actually some evidence to show now that when you break down that localized fat tissue, it will just deposit somewhere else in your body. Which is really interesting.
Yeah.
So
anybody who sells you any of that, I just think is a complete nonsense. And then the other one that's like out and proud in loads of clinics doing it is this machine that it can It's basically like doing 1,000 squats or 1,000 sit-ups in 20 minutes. It's quite ferocious. I've tried it on both areas, stomach and bum.
Yeah.
And I was like, I'm sorry, but this is not like doing a crunch. Because I know, because I go to gym all the time, you're actually physically moving those muscles, stretching, compounding them, making muscle tears. When you make muscle tears, it repairs. That's how your abs get stronger. That's how they build. This is not doing that. It's just vibrating me violently. And I don't care what study or how you've bullshitted the information to sell these into clinics, but that is never going to work.
There's lots of different machines, actually. There's loads of different machines. And from a pure business standpoint, it's something that I'm never going to go into. And the reason for that, as I mentioned, it's a very juvenile industry. So with that, it's changing so much. If I go and spend 120 grand on a machine, there's going to be a new one in 2 years. By the time I've paid it off, there's going to be a new machine. So just from a purely business standpoint, I'd rather stick to things like the injectables where the cost to entry is low and I know that I'm exactly what I'm going to deliver to my patient. Now, the studies, as you mentioned, they're all pharma driven, so you have to read them all with a very cautious eye. There are machines that shake you, as you've just mentioned, with vibrations. I don't believe that that is doing essentially anything. There are machines that can induce contractions in your muscles via electrical stimulation that actually creates your muscle to contract beyond what you can actually make it do. Now, don't know much about it. It's not my area of expertise. The question that I ask myself is, if you're not stimulating that movement, the muscle's just doing it because the electric is going, therefore creating ions to move across the channel of the muscle cell, therefore it contracts. Is your cell doing a function there that it's going to tell itself to get better at, or are you just driving something? I don't know the answer.
I would say the first option. I would say it's not doing anything. I can tell you that.
I don't know the
answer.
answer.
And then what people think they can go and eat a pizza and they're going to have this amazing stomach. It's just, and the 1,200 quid. Like it's 1,200 quid a course.
Yeah.
Like, are you joking me?
Again,
give me 1,200 quid. I'll tell you how to lose a bitch up on that area.
Again, this is another reason why I've not gone into devices in my clinic, because I think that, again, the evidence for them is less robust than other things that we can offer.
Yeah. And you know what? And when I see a clinician pushing this, I lose credit. I literally lose like all respect I have for them overnight, because I'm like, in your heart of hearts that is not going to work.
So when we come back to that's reputation, isn't it? So that's another thing that with these machines, I'm not going to name them because there's a million, but I would much rather say to my patient, this is what is going to happen as your result. Whether that be for toxin, I'm going to soften your lines by reducing the movement. I know exactly how much volume I'm going to replace with 1 ml of filler. I don't really want a relationship or to sell something to my patient where the conversation is, you're going to need 3 to 6 sessions of this a month apart. You're going to be very red and in pain for a few days after everyone. You're going to be a few grand shy and it might work.
And you're not, it's not going to work.
Like, I've had patients who've come in and they've had these treatments and they swear by them. I've had patients who've come in and gone, I spent $1,000 and it did nothing. That's not the treatment that I personally want to deliver, because my whole business model revolves around the relationship I build with my patients and that trust and that integrity that we've already mentioned.
Absolutely.
Through things like saying no to treatments that you don't do, through not offering treatments that you don't 100% believe in. That's how you actually maintain patient relationships. And that is why I don't spend loads of money on marketing. My patients market for me.
Well, exactly.
They say, go to Jordan. He won't sell you any crap.
Yeah.
He will only tell you what's good for you. So when I've hired business coaches and things, or skincare companies that I've worked with have looked at my new patient acquisition levels, they're saying things like, why is everyone else struggling to get new patients, but your new patient acquisition always maintains a constant conveyor belt? And I'm like, because I just offer a good service.
Yeah.
So people want to tell their friends about a good level of service. Now, marketing is, you can't get by in 2024 with any business without marketing. Now, aesthetics is the only medical specialty where we have to market ourselves through social media, which creates such a strange environment with loads of flaws. But in this industry where you're not selling a product, you're selling a service, there is no better marketing tool than providing a good service.
100%, yeah.
There just isn't.
Yeah.
And I tell my mentees that all the time. I run a mentorship scheme in London, and they're like, how do I get my name out there? I'm like, just make sure your patients are very, very happy at the end of the day.
Exactly. Give them an unreasonable level of service and you'll never get a bad reputation. And you'll never get a bad reputation by turning down money. 100%. I also say the same things. Sometimes I say, this product's not right for you.
Yeah.
You know, listen, I could sit here and take your money. I'm not going to. There's just no point.
Exactly.
Yeah, absolutely. Speaking of like weight loss things and things you wouldn't recommend, how do you feel about lemon bottle?
Fine. So
explain what lemon bottle is for people who might not know.
I'll struggle actually because we don't really know what it is, do we? So lemon bottle, it's again, it's buttered up on social media. I think it went massive on TikTok.
Yeah.
It's an injectable that is a liquid that is supposed to dissolve fat tissue and leave much less inflammation than the other fat dissolving injectables that are available on the market, which are prescription only medications that I actually don't offer, by the way, for a number of reasons.
Yeah. Again, I'd probably agree with that. So I've got my own opinions on them too.
If you Google lemon bottle or try and go on pharmacy websites, and there are certain pharmacies that stock it. I think most of it comes from non-pharmaceutical sources. If you actually try and find an ingredients list, I've tried, it's impossible. So how can I then look into the medical literature and say whether, first of all, it will actually do what it says on the tin, will it actually dissolve fat, and whether it's safe? I can't. It's not CE marked, which is just a standard thing that anything that we're putting into our body essentially should be CE marked to say that it's safe. There are no studies to say that it's either safe or effective that are available to me as a doctor to say that I should inject this into a patient. So anyone who is injecting it, either they're naive to that because they're not a medical injector, and I almost forgive them more than the medics, and there's only a few of them, but I have seen them, the medical people that are offering it, that's unforgivable, in my opinion.
Does the other people in the industry ever jump on the medics who are doing it and say, what are you doing?
I have seen people call other people out for certain things, and they're very brave. I think you don't want to make enemies unnecessarily. More recently, I've seen people calling out things like analysing celebrities' faces for what work they've had done, or speculating what work people have had done, which again, is it educational for people to understand what's available to them, or is actually an invasion of that celebrity's privacy? Because frankly, unless they've come out and said they've had that work, you probably don't actually know.
I know, but sometimes you can see it a mile away. Blake Lively's 100% had a rhinoplasty. She looks well better with it, by the way. 100 million% right thing to do.
Yeah.
Looks way better. Probably wouldn't be getting the roles that she gets had she not had it. And that's the world we live in.
And I think people probably don't jump on other people and call people out for that fear of making enemies, but maybe they should.
I would think it's something like lemon bottle. If I saw, I don't know, somebody in my industry doing that, I'd be like, what are they doing?
For what it's worth, I've only seen, obviously Instagram is where the industry mixes. And I can only think of 2 people that are clinical that I've seen that offer it. And no, I didn't jump on them.
No,
so
you just think,
I was just like, well, hopefully I did do a post on my own Instagram to my own patients and other people about why they shouldn't have it.
This.
And I did say on it that anyone who offers it, avoid them for anything else as well, because it tells you a lot not their ethos. I didn't put it on their promotional stuff.
No, absolutely.
Yeah, not here for the arguments. I want a quiet life.
Well, yeah, absolutely. Why have the drama? Absolutely. Yeah. Okay, so that's lemon bottle. What I like about you is you debunk a lot of myths as well. So is there anything else that's in the industry or kind of that you say that you think, oh, that is like so like old hat now, you'd never do that, or things that like now we just don't do in the industry?
So, I mean, there's always things that come and go, and we've picked up on a lot of the things already. We've done a very good job of covering all the things that I don't do. There's new things that are coming out, and it's not I'm not going to do this. It's I'm going to wait until I know that I'm doing this for the right reasons. 2
things that I see everywhere, and everyone says, oh my God, you should have it. And I'm a bit like, my God, my maintenance bill for just general living is ridiculous. So, and I actually have never done it. So 1 is polynucleotides, never done that. And 2, Profilo, I've never done that.
So polynucleotides are amazing. I use loads of them. Now, I probably do more injections of polynucleotides now than I do of fillers, and I've only been using them for about 2 years.
Right.
They only really boomed in the aesthetics industry for 2 years. Now, I've just said to you that I'm quite cautious when something new comes to the market. Why didn't I have that with polynucleotides? They're not actually new.
Okay.
They've been around for 20 years. The Italians, the Koreans have been using them for years, primarily in wound regeneration.
Right.
So if you've got a scar, polynucleotides are incredible at stimulating your fibroblast, which is the cell in your skin that lays down new collagen, helps to repair tissue, lay down new blood vessels. It's antioxidant in nature. So we know that it's safe in human tissue because it's been being used for wounds. We're just transferring it to skin that is damaged, not through a cut, for example, but damaged through UV exposure, the pollutants in the air, and just the aging process. So it's not anything new. We're just transferring it to aesthetics. So therefore, I'm happy to jump on that bandwagon straight away and be like, this is a safe thing. Now, do you, sat in front of me now, do I think you need polynucleotides? No.
Why not? Because I am aging.
You don't need it.
In pollution
it's not
all the time.
required for everyone. I've had it under my eyes because I get quite crepey skin under my eyes. It's brilliant for thickening that area. It's probably the area that I use it the most.
Right.
But
would I not just get a full face of it?
The thing is, right, so let's look at this. Right now, your skin is well hydrated. You've probably got a decent skincare routine. You look after yourself.
I really don't.
Do you know? Yeah. Fine. You hydrate well, you eat well, you exercise, you look after yourself in general. I'm not going to ask you how old you are, but you're relatively young. Your skin hasn't gone through enough of a damaging process or a breakdown of collagen that you've got fine lines and wrinkles across all of your skin when you smile. It hasn't got to the point in one specific area that your under eye skin is very thin. So I don't look at you and go, there's an area that we're going to see a real tangible difference when I do this. However, what is very popular in places like Brazil, which is like the mecca for aesthetic medicine.
Is it?
They are mad for it. Everything. They want everything.
Really?
They've got this idea of collagen banking.
Yeah.
Which is where actually we know we're losing collagen from about 25. If maybe we start to actually show that clinically at 35, 40, could we be investing in this collagen banking from about 25?
By taking it exogenously in like a sachet or stimulating it?
Injecting something that stimulates it. So if you're going to take a collagen supplement, the vast majority of it will be broken down by your stomach acid into amino acids. Now, some of that will be taken to your skin and built back into collagen, but there's not a massive body of evidence that massively supports collagen supplements. You are, in my opinion, much better doing something to the skin to stimulate collagen production directly by the cells that create collagen in your skin, such as polynucleotides, right? So if you came to me and said, look, I'm 25, I'm very concerned about my appearance and I don't want to look like I've aged when I'm 40. Can I start doing polynucleotides? Well, yeah, I could do it. You're probably not going to see any difference whatsoever in the short term. Maybe it makes sense in the long run. Most people at 25 don't want to spend that amount of money.
Well, I was going to say, who's got that kind of cash?
You're looking at 250 quid to 400 quid per session for polynucleotides.
And how often do you need to have it?
Generally, you would do 3 to 4 sessions 2 or 3 weeks apart, and then you would top up every 6 to 9 months with an extra session. So that's a lot of money over a long period. Realistically,
it's another income. I'll tell you now that literally for everything, I don't get anything done purely because I've got no time. So otherwise, I'd have the whole thing. But exactly. I'm telling you, my bill would be about 12 grand a year.
So this idea, you're right. This idea about collagen banking, it would be. I don't know where it came from. Probably the people that sell things that stimulate collagen.
Yeah.
They probably said, we're missing out on 15 years worth of collagen loss. In my opinion, wait till you're starting to see some sort of differences. And then when we use these collagen boosters, biostimulators to actually re-stimulate that collagen, at least you'll have some gratification of feeling like you've seen the difference and you know you're getting your worth from it. Now, that's not for me to say that collagen banking is not real. It may well be. It's probably just not worth the investment for most people. That makes sense.
Unless you've got lots of money at 25.
Yeah, exactly.
What about, so Profilo, what's Profilo?
Quite different. So this is a question I get asked often, which of these would be better for me? And the answer is different for every single person that sat in front of me. Profilo is uncross-linked hyaluronic acid. So where dermal filler is cross-linked hyaluronic acid, the more cross-links it has, the firmer a gel it is, the more it stays where I put it. This stuff, I inject 5 injections onto one side, 1 onto the other side, and it basically diffuses throughout the tissues to rehydrate the mid and lower face. It will, to a certain extent, stimulate collagen, but we know that hyaluronic acid is nowhere near as potent as polynucleotides at stimulating collagen. So if you're dry, if you've got dry skin, hyaluronic acid, Profilo, is a better option, or any other hyaluronic acid injectable. Profilo is a brand. Is probably more beneficial for you than polynucleotides because you'll get the glow, you'll look healthier from it.
Right.
Whereas if actually you are well hydrated, but your skin's getting lines in it, polynucleotides are the option for you. There are actually preparations that have got both in it, by the way.
Right.
So again, it comes down to actually sitting in front of a clinician with the experience of using both, who actually knows about the clinical studies to tell you that. Now, there aren't many clinical studies, randomized controlled trials that show the difference between different products in the way that I've just explained it to you with confidence. There is one that shows the difference between polynucleotides being better than hyaluronic acid at stimulating collagen and the combination of the two being better. Again, most people don't want to come and pay you for 3 sessions of Profilo at 250 quid to 400 quid a pop and 4 sessions of polynucleotides. So you have to sit down, have a real conversation with that patient. These are what the products do. These are the ones that I think would benefit you the most. Of course, if you were a millionaire and there's an endless pot of money, do it all, fine, crack on, you look amazing. That's not most people, right? So you have to have, and people in aesthetic medicine, especially in the early years, find it really hard to bring money into that conversation. But it's important because...
Well, it is important because you've got to be able to maintain.
Exactly. So someone sat in front of me who can afford to spend £400 per year on their aesthetic treatments, my conversation with them is completely different to if I've got a 50-year-old actress sat in front of me sat on billions of cash.
Yeah, exactly.
Because that impacts what you can sell them, and it is a sale at the end of the day. So you have to have that conversation.
Yeah, no.
Sometimes what I have done with filler treatments is, I said to you, right, there's no point me doing 1 mil. I've given them almost like a priority shopping list.
Yeah.
Where I've said, honestly, I could do all of these things because your skin has aged, because you've got movement lines, because you've lost volume. All of these would benefit you. I think if you wanted to spend £500, this would be the one treatment. If you wanted to spend £1,000, these would be the 2 treatments. Then you've got to think about the maintenance. But then if you want to spend and present it to the patient like that, so they can then take that away, make a proper, well-educated, informed decision, and then come back to you with a plan that they've developed based on your recommendations. Money's not a dirty word. People think it is because we come from the NHS. No one's used to, at the end of, you don't go and put a catheter in on a night shift and be like, that's 40 quid, please.
No, exactly.
So we're not used to it, but you just have to get used to it and talk to your patients about money because it is important. Yeah,
absolutely, because you're absolutely right. I don't want to start something, get used to it, and then be like, well, now I can't afford the upkeep of it.
What's the point?
I mean, I only do Botox. That's all I'm doing at the moment. Just purely for time. Otherwise, I would do loads of other stuff.
Yeah.
So as we mentioned, I've got a terrible skincare regime. It's absolutely shocking, And then you've got like skincare ranges. Abargi is one of them that everyone where I go tries to upsell to me. Personally, I find it a bit too aggressive and I don't really like it.
Yeah. The sales or the skincare?
No, the actual skincare.
Fine.
I think it's quite aggressive skincare.
Fine.
And as you mentioned, as you get older, skin gets thinner.
Yeah.
Do we really need that abrasiveness on our skin all the time?
So Abargi is
like a medical
prescription
grade
skincare, the majority of it. So they sell non-prescription grade skincare, medical grade skincare, which is great. And I work with it among many other brands. But the majority of the stuff that they sell is prescription grade. Now, their key sale is Abargi New Derm, which is a very expensive, laborious 7-step skincare routine that for the right patient is amazing.
Right.
Now we're talking patients who've got post-inflammatory hyperpigmentation, or maybe they've had acne that's caused scarring with pigmentation, or melasma, for example. These are medical conditions, not Alyssa Corrigan sat in front of me who's got a normal skincare routine. However, I do work with Abargi as well as other brands because I think to think that one brand have mastered every skincare ingredient is silly. You need to go and really work out from all the brands who's good at what, and therefore cherry pick that and deliver it to your patient so they've got the best routine. About some Abargi stuff is great. You're probably using stuff that you probably don't need.
I'll tell you what I use now and you'll be like, right.
Or the person who's looking after you hasn't been hands-on enough. Because when I'm selling things like Abargi to my patients, I'm very clear to them that You haven't just walked into Boots and picked this up off a shelf. I'm giving this to you as a medical practitioner because I think it will benefit you. You are not just buying the product, you're buying my care. So I want you to message me if you're thinking it's too aggressive or you're getting dry or you're getting breakouts, because I need to look at how much you're using, how often you're using it, and guide you with it to get the best.
Okay, are you ready for this, right? Okay, so I use a CeraVe cleanser.
Good, which is what I advise for most people. It doesn't need to break the bank.
No, it doesn't. Well, the reason I like about it is I had a lady sat here called Katie Cottam who told me that most cleansers have got a pH almost like bleach. So really too high pH. Okay, so it was like bleach is 12. Most cleansers are 11 and 10.
Right.
So then I went down a rabbit hole and I was like, oh my fucking God, right? And actually the pH should be so much lower than that. So went and had a look, and actually Clinique one, it was just like making me feel dry and tight. It's way too harsh on the skin, so I got rid of them all, binned them all. CeraVe is like the only one that I think is absolutely lovely on the skin to cleanse with. And you know what else came out top? Dove.
Yeah
In every study, Dove beauty bar.
Fine.
So it needs to be a pH of about 5. I can go through pHs of Body Shop, terrible, Johnson's, terrible, baby stuff, terrible. That's another podcast for another day. So I start with CeraVe, right? I've cleansed my skin, that's it. And then I put on like a night cream, which is whatever I've got in the drawer that day. And then in the morning, I'll like maybe wash my face, maybe not. But then I'll put on some Clinique Moisture Surge and then I put tan drops in it. Right? And then I just put on a bit of eye cream and I'm done.
Can I ask you a question?
Go on.
You know, you've been upsold this Obagi stuff a million times.
Yeah.
Has anyone sat and educated you about each step of a skincare routine and what they're for?
They have. And like
You've
I said, I've had so many people sat on this podcast who are like, and then I drop in a bit of retinol from time to time, but I bought that in Mexico.
Yeah. Is it tretinoin or retinol?
It's tretinoin.
Fine.
Yeah. So
that's pretty aggressive.
It's very aggressive. Yeah. So I'll do that from time to time. And the reason I haven't done it over the summer is because I don't want to strip my skin off. And also I'm sat on the podcast so much every week that it makes my makeup sit horrible.
Fine.
And then I'm looking at my makeup and thinking, why am I so patchy?
Probably don't need a prescription vitamin A derivative. That's
no,
why.
It's probably really
using a low dose retinol.
Well, I've got the Medicates, but I didn't think that was stripping me enough.
Fine. So vitamin A derivatives, which is an umbrella term that covers retinol and tretinoin, retinal as well. They are more or less potent depending on the brand you're using, the strength you're using, the amount that you're using it. And everyone will get some side effects at a certain point. So you almost have to build up to that point and then pull back a little bit so that you know that you're getting the most active ingredient without getting any of those side effects, because everyone's got a different tolerance to a vitamin A derivative. But you've just given me such a scattergun approach to skincare, which is what loads of people do. Now, I work with a company called Get Harley, which is basically a skincare concierge service. And a lot of clinicians are like, why are you using a company that takes 40% of your profit through sales? And skincare is sales. So you ask yourself the ethical question, should you as a doctor then be pushing skincare on someone who has come to talk to you about Botox or filler, for example? Now, actually, if I assess your face and you've lost volume, but I don't actually give you a bit of advice of how to protect yourself and how to slow these things down with medical grade skincare, I've probably given you half a service. So it's not about sales. It's about making sure you don't go to the dentist without them telling you, you got to brush your teeth twice a day, every day at home. Do the simple things, because if you're doing something every day at home, that can probably do as much as I can do with a needle every 3 months in different layers, don't get me wrong. So I don't think it is a sales pitch, but the reason I forego 40% of the profits from sales is because I don't want it to feel like a sales pitch. So I don't physically hand you some skincare at the end of the consultation. That allows me to give you an education piece on, this is why I want you to use an SPF, which is the first thing for every single person, because UV exposure is responsible for 80% of skin aging, all right? So only 20% is genetic. So if I haven't told you to wear an SPF every day, I've done you a real disservice. A lot of people could be using a vitamin C. And again, that is a product that actually is worth spending a bit more money on. Cleansers, I think most of them go down the sink. So if you're spending £100 on a cleanser, you're probably being ripped off.
So which vitamin C would you recommend?
There's several for different patients. So I'm not going to throw a brand out on here.
Okay, fair enough.
Because I have used several myself. I have 3 or 4 that I recommend to different patients, some for oily, some for dry. It's not a one size fits all, and they're not all from the same brand.
Right.
So there's a million products. My job is to look at the patient in front of me and say, this is the one for you. Some people, that might be a 40 quid one. Some people, that might be a 120 quid one.
Am I right in thinking that if you go into Home Bargain, you see something that says, look at your face, vitamin C on it, it's not going to be any good.
The likelihood is that it's going to do absolutely nothing.
The extra ingredient just is not going to be there.
For vitamin C to be really potent, it needs to be L-ascorbic acid, it needs to be over 8%, it needs to be in a dark bottle because even light will oxidize it to a non-stable product. It's a really, really unstable product. So actually that's the reason why it's an ingredient that I'm saying that you probably do need to spend a few quid on this if you want to do anything.
When you open the bottle, is it going to get oxidized over time?
It can do, yeah. So there's different types of bottles, there's drippers, there's different functions that allow less oxygen to get in.
Yeah, so you want to be using it. You can't just have it sat in the drawer for 12 months and expect it to be stable.
If you've got a cleanser that's got a little bit of vitamin C in it, it's probably not doing a lot. You need a dedicated vitamin C that's designed for that, yeah. But anyway, going back to what I was saying about Get Harlot, I can give you the education piece now of, that's why I want you to use an SPF, that's why I want you to use a vitamin C, a vitamin A derivative probably for most people, a CeraVe cleanser for most people. That's kind of like the barn door stuff. Now, obviously it becomes a bit more complicated. If you're acne prone, if you've got pigmentation, if you're rosacea prone, then there's obviously a lot of nuances that change those things. But I can confidently sit here and give you my education piece based on the skin scanner that I've used and the skin that I'm seeing in front of me without you thinking it's a sales pitch, because I don't put it in your hand when you leave.
Yeah.
Now, you'll then get an email with a lovely platform that says, this is your morning skincare, this is your evening skincare, this is how much each product costs, how long it lasts, and therefore you'll spend this a month on skincare. You can then decide, if based on my education piece, whether you want to buy it or not. I haven't lost my reputation. You don't think I'm a pushy salesperson, but I've still educated you and allowed you to do it. That is worth losing 40% of the profit for me.
Yeah.
God, this is a right sales pitch for Get Harley, isn't it? A lot of people don't love them, but for me, that's brilliant because of the way my business runs.
Yeah.
So skincare is an interesting one. You can spend a £5 on a product in Boots. That's probably not going to do much. You can spend hundreds and thousands on a product that's probably no better than one that's 50 to 100 quid. Again, it comes down to making sure you're sat in front of someone that you wholly trust has gone and done their research and is telling you a recommendation with you at their best interest. That's the key.
And I think that is where we should finish because that was unbelievable. So, right, I've been told, right, okay, so I'm now not going to be going to the back street, go and getting my Botox done. And I'm going to go and get some polynucleotides in my crepey eyes as well. And
so after all that, you've made it a sales pitch.
And I'm definitely going to go get some new skincare. So Jordan, thanks so much for coming to chat to us.
Pleasure.
If anybody wants to get hold of you, follow you and get more pearls of wisdom from you, how can we do that?
Perfect. So I'm on all of the socials at Dr. Jordan Faulkner, which is Dr. Jordan Faulkner, or at Allo Aesthetics, ALLO Aesthetics. They're my handles where I post loads of stuff.
Great. Hello. Okay. Fantastic. Thank you so much. Thank you.
Thank you.